Hi, this is Dr. Antolak from theGentalDentist.com in Shelby Township, Michigan. And today I'd like to talk to you about dental emergencies. For us right now, it's just the beginning of the summertime, and with summertime comes potentially a lot of accidents, or some accidents for children. And what I want to do is just to talk briefly about what to do in case there is an accident. Many of the accidents that can take place, let's say a child is on their bicycle and they hit a bump, or something happens, they tumble off the bike and they hit the pavement. Or they're running along, they're running, and all of a sudden they trip and they fall and they crack a tooth. What is the best thing to do? So I want to address a couple things. First thing is if a tooth breaks off, let's say a tooth cracks and it's just a break like that, but the tooth is still in place, it's stable. What I would suggest is look for that segment of the tooth that fell off. What we can do many times is we can actually, with that patient coming in, we can actually bond in that segment of that tooth to the other part, just using a thin bonding agent, and we literally, like super glue almost, it adheres from one to the other, and many times that's all that's necessary. That's a very simple type of thing to do, but the important thing is to find that piece of tooth and give us a call right away. The other more serious problem is when that will be at a different level. It's called avulsion, and avulsion is when if it falls and that tooth literally will, the bony fragment will do that, and the tooth can fall out. What's important at that point in time is to find the tooth, okay? Find the tooth, and what you want to try to do is to get it right in the socket. You could just gently, a possibility is to have the child in the mouth just kind of take off if there's any dirt on it or anything like that, just to do that and just to remove some of that dirt, and then try to put that tooth right back into that socket, right where it came out. And because the reason why that is the longer that, when it comes out, there's an attachment called a periodontal ligament that separates out, and also the nerve and the arteries and everything that feed the tooth, they come out with that when the tooth comes out. So the faster you can get that back into the mouth, the better it is, the better chance there is for these to reattach from the tooth to the bone. The reason why you don't want to scrub that at all, you don't want to scrub the tooth or disinfect it or use anything like that on it, because those will kill off these what's called the periodontal ligament. It'll affect that attachment, and which will not allow this reinsertion to be effective. Okay, if you can't figure out how to do that, you can store it in milk and then get to the dentist within a half an hour. So I know it's the faster it is, the better it is. The faster you get that tooth in there, the better it is. That's the best thing. Second best is tooth. If you as a parent have it, put that tooth actually back into your mouth. You want to, if you have no other choice, you want to keep it hydrated. You want to keep it wet and damp, and so that when you get to the dentist, you can insert that tooth back into the socket, and then we fix it with we bond it to the adjacent teeth for the short term, and then go from there. Sometimes teeth can do a partial avulsion, we call it, where it comes out and it's sticking out of place, not totally loose, but sticking out of place. Once again, if it's possible to push that tooth back into location, I know it's going to hurt, but try to get that before the blood starts forming where it came out, but get that in there, and the likelihood that's going to heal well is pretty darn good. The important thing is getting in immediately. So by the time you're done listening to this, it's too late. You should have been calling your dentist. But for dental emergencies, that's one thing that's important. You can give us a call if you have any questions about that, or even if something happens, give us a call. 586-247-3500. If during that time, if we're not in the office, you'll have the opportunity to reach me on my cell phone, which I always carry and I almost always answer, so you can reach me that way too. So if there's any questions about that, please give us a call. Thank you.